Welcome to Mental Health Matters, a community approach to overcoming the childhood mental health crisis. My name is Derek Allen. I'm the Executive Vice President and Chief Operating Officer here at Starr Commonwealth. Here at Starr, we have spent over a century on what is now a national emergency, the mental health of children and adolescents. We are so proud to dedicate our 110th year to generate awareness and have conversations with community partners as we work together to solve this important issue. Today's session in our Mental Health Matters series is expanding the continuum of care, strategies to increase accessibility of mental health services. In this session, we will focus in on the innovative and impactful efforts of Calhoun County's mental health provider, Summit Pointe, and how their work is expanding access and increasing the well-being of individuals, their families, and the communities they call home. From this conversation, we hope you walk away with some new ideas to pursue and new partnerships to explore, to expand access to care in your community, and ensure we are all doing our part to end the child and adolescent mental health emergency that is impacting countless lives. I'd like to give a special thank you to our sponsor, ITC, for their financial support for this session, and our friends at Summit Pointe for partnering with us and our Calhoun County community in so many powerful ways. And I'd also like to thank our studio audience joining us on our historic Albion, Michigan campus, as well as all of you joining us virtually. We are honored to have you join us. And with that, I'm excited to kick off our panel discussion. Today's session will feature three talented professionals and friends of mine that I've had the pleasure of working with and calling friends for many years, each bringing a wealth of knowledge, experience, and results to this important conversation. It is an honor to be joined by this powerful group, so let's get to know our panelists today. Could each of you briefly introduce yourself, stating your name and sharing what inspired you to join us today?
I am here today to talk about the programming that we do at Summit Pointe and to shine a light on the impactful work that we do in Calhoun County.
Thank you, Jeannie.
My name is Megan Taft. I am the Director of Community Engagement at Summit Pointe, and I'm inspired to be here today to talk about mental health. I don't think, unfortunately, it gets a lot of, you saw the statistics, I think, before we started, but to get accurate information out there for folks, because it's needed, and we need to have more conversations like this.
Absolutely. Thank you, Megan.
I think what inspires me the most to be here today is really the colleagues that I've had the pleasure of working with over the course of the last several years in mental health, as well as all of the professionals really around the world kind of looking at mental health and trying to figure out how we can address this crisis. This is hard work, and it's also inspirational work. And so I continue to be inspired by the people that we work and partner with every day to kind of meet this huge need that's just really critical for kids we serve. Amen.
Wonderful. Thank you again for joining us. So I'm going to start with our friends from Summit Pointe, Jeannie and Megan. Your, I'm going to say newish program, First Step, seems like a pretty innovative way of meeting the mental health needs of a community. Can one of you or both of you talk a little bit about where the idea came from and how the idea became a reality?
So First Step is the Psychiatric Urgent Care Center. We opened in March of 2021. So we are celebrating our second year of operation. And so if I look back, I've been at Summit Pointe 28 years. And so a variety of roles, have always looked at access to care, had been responsible for access to care, access to mental health care in my other roles. And I had an opportunity, we all have Facebook. There was a community resident that was very upset with our services. She was saying everything on Facebook about us, and I had a community member reach out and broker a meeting with us. And so Megan and I went to this meeting, and we're sitting in this room talking to this woman. She's sharing with Megan and I how incredibly difficult it was for her and her family to navigate mental health services. And so Megan and I are sitting there, we're talking to her, we're learning a lot, and what kept coming to mind is access to services shouldn't be this hard. It just shouldn't be this hard. And so we closed the meeting. I've stayed in contact with her over the years, but we closed that meeting, and I just kept thinking about, what is our system really like? As a director, I had responsibility. I knew what our system could and couldn't do. Our system at the time was, you want access to care, you make a phone call, you wait for the phone call to come and get a phone call back, you wait for your appointment, you come in for your appointment after delay, you want more services, you have to come back for another appointment. That time makes a difference when someone's in a mental health crisis. And if you needed a medication appointment, you were then months out after that. And so I thought, okay, how do we move all of this to the front door? Right? So how do we push all of our services to the front door? So I sat down with other community partners from Bronson, from the Battle Creek Community Foundation. I used a consultant to come in and say, here are different models that work across the nation. I had an opportunity through working with him to go to Nashville for a conference and see a new psychiatric urgent care that they had opened in Nashville. And so I went in, I toured the place, asked a lot of questions. I thought, this might be a model that works. It is very innovative, and can we do this in our community? So I brought all of that information back. I was very fortunate. We had some great partnerships that allowed us a grant to get a building. At the same time, we applied for some SAMHSA grants that gave us some funding for staffing, which really then led me to, okay, so I have all of these pieces together. How do we start this? So we decided to call it a psychiatric urgent care center on purpose, because for outward-facing community, people know what an urgent care center does, right? It's not my primary care office. It's where I go. I get immediate help. I may not have follow-up services, but it's where I go. So that's why we call it a psychiatric urgent care center. Many other people may call their service similar to this a crisis center. I didn't want that kind of stigma to have to make someone think about, am I in a crisis? Do I not go? So we settled on psychiatric urgent care center. We settled on what our clinical flows will look like. We had the extra staffing grants. And what that allowed us to do is look at what happened at that visit and allowed staff to follow up after the visit, right? So it was important to me not just to get somebody through the door, but to have that follow-up service to make sure whatever was identified could actually occur for that patient and actually help them to get to that next service. So that's kind of the origin of this from the Summit Pointe perspective. At the same time, from a community perspective, there was a community needs assessment that happened. Behavioral health, mental health, substance use disorder, access to these types of services scored very high on need. And so I used that information, all of the other pieces that I just spoke about, and we launched in the middle of a pandemic. March 2021, we provided face-to-face services when we could. People had access to those services. We did what we needed to do to make sure that our community was served.
It hadn't occurred to me, the thought of a psychiatric urgent care, until you first told me that this is what Summit Pointe was going to be doing. And it just makes so much sense. The fact that more communities don't have these is the problem. I'd shared with you guys, I working at Starr in my neighborhood, I'm the Starr guy or the mental health guy, and actually had a friend knock on the door and say, you know what, my daughter's in crisis, I don't know what to do. And I was able to hand them the information about First Step, and they were able to go. It's just incredible. Something that just made so much sense. We didn't have it for so long, and I'm just so thankful that you guys brought it to the community. I also didn't know, Jeannie, and I know you pretty well, I didn't know that this started with somebody criticizing Summit Pointe on social media. And I just want to credit you all for the fact that it's so rare, I think, that those things on social media turn into something productive. But to actually say, you know what, this person has an issue, let's meet with them, let's find out what it is, and let's get to that root cause of that problem and solve it. That's incredible. I wish more people would do that.
Yeah, I think in addition to, we were hearing it from our community partners, right? We were also hearing some of the feedback of, I'll talk a little bit later, but I have the opportunity to work very closely with law enforcement, and their options were limited, right? They didn't have, and other community partners, right? You heard Jeannie talk about from a perspective of somebody who may be needing treatment, but those community partners had an option of going to the ED in a moment, right? That was really what they could do to help service someone. So that was born out of this need too. We started to see, let's give law enforcement another option to bring someone to. They may not meet a need of going to an ED, and so we've seen that as a means of kind of diverting them. Or, unfortunately, as we know, a lot of folks end up in a criminal justice system,
Yeah.
and so this became another means of diverting and really getting folks treatment, which is our goal. Versus them entering in systems that probably weren't going to be as helpful long term.
As you both know, I try to show up to as many Summit Pointe events and functions as I can because I really like the cookies that you guys usually have, those frosted cookies with your logo. So I've had the opportunity to visit First Step. And not only is the service important and impressive, I was struck by just the design, the look and feel at First Step, and the intentionality, I think, that was put into that. Could either one of you speak about that just a little bit and describe what like those in our audience, if they were to visit First Step, what would they see, and what was the reasoning behind designing it that way or presenting it that way?
Yeah, so we worked with a local architect and some of my internal team members, and we were trying to capture warmth and welcoming environment. As soon as you walk in the door, if you don't feel that within a few seconds, you're not going to stay. You're going to close down. You're not going to be as open. So we tried to make a really an environment that created trust right away. And so the building that we used to be a laboratory where you went and you got your blood drawn. And so what we did when we walked in is I said, okay, so here's the waiting room and here's the places where you're going to have your lab draws. And what we did for the urgent care center is we flipped it. So in the middle that used to be a waiting room is now our team room. And all of the 9 rooms that surrounded that is our intake rooms. And so when you walk into a waiting room. From the waiting room, you can go into one of the 9 intake rooms with staff. More importantly, from the huddle room, I have one-way glass where everybody in the huddle room can see what's happening in the 9 rooms around. So we can see how people are interacting with our staff. We can watch when we're not in the room. We can make sure that people are safe. A couple other things that we looked at doing, we have accessibility to a shower. Some people come in and they just need a warm shower. Helps, create a nice trusting environment. Some people want some food. So we have a small kitchen. We offer them some light snacks. Just trying to do everything we possibly can to really make the relationship very open and trusting, and the environment conducive for having a good first interaction, right? So we know, because we're in mental health, that first interaction means everything to a patient.
Sure. Yeah, and if I'm remembering right, those 9 rooms they're not 1A, 2B, they're like courage and bravery or something, strength and hope and those kinds of things. And you have an entrance for like law enforcement or first responders also, right?
We do, yep. It's on a different side of the building than where somebody may come in on their own or independently. But yeah, we do have a designated drop-off area where our law enforcement partners
To give that privacy, that confidence.
Absolutely.
It's you do feel the warmth when you walk in. It doesn't feel like a traditional emergency room. It's not dirty. It's clean, it's inviting, it's beautiful. Our founder at Starr said, beauty is a silent teacher, right? And part of the intentionality of this beautiful campus we're sitting on was you take kids who maybe are coming out of really difficult situations, they come to this beautiful campus, and just the beauty of the environment itself conveys some level of value and self-worth. And I was really moved by that when I visited First Step. So before we move on, because First Step is an awesome program, but it's only one part of the continuum, how is First Step going? You're celebrating your second year now. So how many people are you able to serve? What are you, most proud of? Are there things that you're still wanting to accomplish with First Step that you haven't yet? How's it going?
Yeah, so I'll take that one. We have just served over 6,000 patients.
Wow.
So we've been open 2 years. That's about 8 patients a day. In the beginning, we were pretty slow as word got out. I will tell you that our business has picked up greatly. I've been down to the First Step huddle room in the last couple of months, and it is more common that I will see at least 7 rooms, somebody in 7 rooms being helped. And so, to me, that means that we are effectively becoming that access point, right? So it's that low barrier. Doesn't matter if you have insurance or not. It doesn't matter what your need is. You come in, we will help you. Substance use disorder, mental health, adult, child, family, whatever that is, you come in, we'll help you figure it out. I think what resonates with me about why we started this program is what happened yesterday. So we had a patient come in, overdosed on our lobby. We were able to revive with Narcan. Ambulance then transported to the emergency department. We have a wonderful relationship with our local emergency department. We have some protocols about initiation of Suboxone immediately in these types of situations. That patient was willing to do that. So emergency department initiated Suboxone and Suboxone for medication-assisted treatment. And by the time I heard about it, I managed to come out of the building and stop by at the huddle room on my way out. That patient was already back in one of our rooms, being signed up for treatment today, right, within the Summit Pointe system. And for me, when somebody asked me why we started this program, that is why, right? So where would that person have went yesterday? What would have happened, right? How would our community have revived this person? And so for me, that's the piece I keep going back to.
Well, and even to the amount of people that you've already served, what was the alternative for those 6,000 people? Right. Was that an emergency room? Was that just trying to figure it out on our own? Right. So just the access that you've been able to open up for people, I think is amazing.
Yeah, I think what we're seeing is, folks aren't necessarily coming to us in acute crisis. They're coming for what we would, categorize as routine need. And so, you heard Jeannie describe earlier, well, historically that would have been a phone call and a sign up for an appointment and wait X amount of time. And, it begs the question, what would have happened? And we know, people don't tend, when you call and want an appointment, you want to be served. And so we're seeing folks maybe access a mental health system that have never accessed the mental health system before, or who have started treatment that is, it's completely new to them. And so when we look at numbers of how many folks are just routinely coming to us for a need, I think that's equally as impressive, because it does speak to just the ease of accessibility.
Yes, it really breaks down that barrier too, because I think at some point it takes a lot for somebody to make a call, and then the length of time it takes for that person to then come in and receive care. Absolutely. What happens in that time? That person kind of might just fall off the radar. They might say, maybe I may not need that, and something could happen in the interim. So you talking about people coming in for routine stuff and just coming in and how easy it is to access those services, I think it really breaks down that barrier that people don't fall off and don't start to get services because they don't have to wait.
Absolutely.
And when someone comes in, like you describe, even though they might have a wait till their next visit, and it's not always with us, right? We
Sure.
we
Might need to
make
refer out.
refers,
Yeah.
we refer out, we look at primary care physician access, all of those pieces. We follow them along, so we have care coordinators that will call them second day out, seventh day out, whatever that is, to make sure that they are getting what they need. Do you have the transportation to get to your appointment? Do you still need to go? Do you need to come back and see us again? So we do a lot of follow-up because as we talked about, that first visit means everything, and you have to have engagement. That's the follow-up pieces.
So, Sarah, you have a really fun job, I know, because it used to be mine. You get to lead all of Starr's programs. I wonder if you could speak a bit about how important the partnership with Summit Pointe has been for the services that Starr, as a private, nonprofit provider in this space, how this partnership has benefited the children and families we're serving, whether it's in schools, with our behavioral health program, or at the new rec program, our newish program, the rec program. Could you speak to that?
Yeah, so a couple of things come to mind for me, and I think, first of all, and we've talked a little bit about it already, the availability of mental health providers, especially, I think, since COVID, and probably even pre-pandemic, the availability of mental health providers is really disproportionate to the need. And so I think what I find to be most impactful from where I sit is our ability to partner has just opened up access and increased the ability for kids and families to receive services. So I think that also ties into kind of breaking down some barriers there. And because of this partnership and our partnership with some of the school districts, kids are able to access services in a variety of different places. So it may be Summit Pointe, it may be us, it may be through our work at the schools. And so I think that breaks down barriers. I think it increases access. And I think maybe kind of reduces stigma a bit, just because if in varieties of settings we have people that are invested in mental health, I think it makes it important and makes it kind of validate some of those concerns and feelings that kids and families are having. I think it also really speaks to a collaborative approach to meet the needs of kids. Because of these partnerships, we oftentimes have so many adults and professionals involved in working with kids and families. So we're meeting kids where they're at in the settings that they're struggling in. So they may be not having difficulty at home, but maybe they're having difficulty in school, and vice versa. So it's really more collaborative, and I find that we're collaborating with multiple professionals in multiple settings to meet kids where they're at. So I think for me, access, breaking down barriers, reducing stigma, and the ability to collaborate are things that come to mind for me.
And I think a specific example of that kind of collaboration is our newish program, the REC. Could you talk a little bit about the REC program, which I also see as kind of an innovative program like First Step in addressing, getting the mental health services and supports that people need right to the front door, as Jeannie said, or right where kids need it. Could you speak a little bit to that?
Yeah, so the REC program really evolved out of our work with Summit Pointe, as well as work with our local school districts. And what we were hearing more and more is that the need, especially in that middle school age range, there was a huge need for social emotional support, behavioral health support, and there just weren't a lot of resources for that particular age group. And so working with our school districts in Calhoun County, and along with Summit Pointe, we designed a program that was focused on really an innovative model to integrate behavioral health services into the school day. So students who are enrolled in the REC program spend half the day at their school and then half the day at the REC program. And the REC program is an immersive program that integrates behavioral health, social emotional support, academic support to really help those kids figure out how they can be successful at school, at the REC, and translate those skills back to their school districts. If we're able to focus on the social emotional piece, can they then transition back to school and be supportive in their school environment. The program is roughly about 8 to 10 weeks, so students will stay in the program half day, and then our staff will transition them back to school, and that type of support, our staff will kind of transition back to the schools with students to make sure that a transition plan is in place, to make sure that they can apply the skills that they're learning at the rec back to school, as well as support the professionals that are working with the students.
Awesome. I was at a school board meeting recently in one of the partner districts, and it was explained to me by one of the administrators that there were a couple of kids who would normally be up for long-term suspension or expulsion, but they were actually able to keep them in school because of the rec program, because they were able to get those services for that young person. So now they still have that half a day in their local district where they're getting those academics, but then they're getting that extra support at the rec program. So back to, improving access and keeping people right where we need them to be, right, to get the help that they need.
And I think there's a real importance, and when we were designing this program, we want kids to be in school, but how can we maybe take this short time that we have with them to really focus on that social emotional piece, so we can get them back to school. What we know is that stress brains can't learn, so can we help students calm some of that, work on that behavioral health piece, and then get them back to school where they can be successful.
That's right. So, Jeannie, I don't just like working with you. I actually love working with you. I think we're good partners. I feel like we're a really good team. Could you speak to a little bit about, from your perspective at Summit Pointe as our community mental health provider, how working together with Starr and others, we have other partners in the community as well that we both work with, but how that has improved Summit Pointe's ability to serve the people that you all are called to serve?
Yeah, so we have clinicians who are in the schools and serving the children. And what I found, so I was starting to analyze and look at the schools where, wow, these caseloads are really high, they need another clinician, they need more hours, more days. But I had a couple schools that weren't necessarily that way. And so what was the difference? Well, the difference, in my opinion, when I was looking at it, the difference was the interventions that happened with Starr at some of those schools. And so that's how Derek and I actually started this whole conversation about how can we work together differently. Because I have limited resources, so I can't just keep putting more clinicians in a school. I encourage the schools I was working with, look at what Starr's doing in these other schools for Tier 1 interventions. And the stronger your Tier 1 interventions are, the less I'm going to get those Tier 2 type kids, which I should see, but they're not inappropriately bumping up to the higher intervention. So, Derek, I know you're asking me some questions about what I do, but I think you have to explain those types of interventions that Starr was providing to put the pieces together.
Yeah, sure. And when I think back, it wasn't, it kind of just happened that it fell into place that Starr and Summit Pointe working together in schools made so much sense. It's not like in the beginning I thought, oh, this will be a perfect complement to Summit Pointe, and but it seemed to work out that way. So for those in our audience who don't know, Starr does training, a lot of training, certification, coaching of educators in public ed around how to understand trauma's impact on young people. Sarah just said stress brains can't learn, and how to foster resilience in all youth. And what that has turned into in many cases is us helping schools build a better set of Tier 1 supports that are trauma-informed, resilience-focused, marrying it right with their PBIS systems or their restorative practices, those things that they already have in place, but helping them pull that all together in a trauma-informed way. And what I'm super proud of at Starr is seeing the results consistently, and now we've got the external validation from U of M that shows us too, but that our work shifts the way educators understand behavior and intervene, And what ends up happening as a result is those behavioral referrals out of the classroom down to the office, suspensions, in many cases, in a year's time, are cut in half. And so when we think about the education system and how stressed, stressed brains can't learn, well, stressed brains also can't teach, right? And so teachers and educators who are overwhelmed with the level of behaviors they're dealing with, if we can get that number down, then not only can those appropriate referrals go to providers then who can help them, but then also the education system itself has a more manageable number also to work with. So it's kind of like Jeannie and I kind of around the same time kind of realized, boy, we're working in tandem here, and if we're more strategic about pushing into school districts together, then that will make even more of a difference.
And I think most of the school districts we work with see that, right? Yeah. So the stronger the tier 1 interventions, my referrals are different, right? Coming in for the tier 2, the tier 3 makes a difference. And so just calming the building down and just lowering everything for a moment allows us to serve the kids differently.
Yeah, I can think of one school that we partnered on where I think it was early on, we just said, everybody just needs to be able to calm down and take a breath. Mm-hmm. That's the goal. The kids and the staff, get everybody just, and then we can work from there. So Jeannie, could you speak to then any advice that you would have for other community mental health providers across the state or the country who are wanting to forge innovative, partnerships with other providers or, folks like Starr or others to create these sorts of programs and ways to better meet the needs of their communities?
Yeah, so, probably a shortcut into this type of work is really identifying where your child study committee is in every school. Yep. If you can find that committee and you can figure out what they're doing in that committee and what interventions they have and how they're monitoring the tier 1 interventions, if I were to think back, I probably could have shortcut about 6 years of learning if I had found that committee. It took me a while to figure out that every school has one. Yeah. There is a, PBIS, there is a system, and asking the school districts very honestly, what are you doing for the tier 1 interventions? Oh, if you're not doing them well, hey, talk to a partner who knows how to bring that into a building, how to change the climate in your building, because that's how you're going to start making a difference for all kids that are going. If I were to give advice, it's how do you just shortcut right into that committee and figure out how they're working, and then how do you supplement the work that they're doing?
That's great advice. I didn't know that was going to be your answer. That's a better answer than I would have given. Yeah. What would have been your answer? I don't know, but it wasn't that. Yeah, that's right. No, looking at data, that's right. And that was a huge, for sure.
I thought you really spoke to something too that's important, is the climate within those buildings and those schools. I think creating that culture can be really critical and a really first step to kind of setting the foundation of meeting those behavioral health needs. Sorry, I interrupted you.
No, that was good. So, Megan, you mentioned law enforcement, and I can't help but think about the prominence that law enforcement kind of occupies in the public discourse around mental health. And so CIT is a particularly important and relevant initiative. I wonder if you could tell folks a little bit about CIT and the impact that you're seeing in the community.
Absolutely. So we've heard, how we're attempting to increase access to care for folks. But unfortunately, we know folks all the time are not walking through our doors. And so oftentimes law enforcement is the response for crisis situations. And ultimately, they're not given the skills to navigate that. So crisis intervention team, really the team aspect is bringing together your law enforcement leadership and other community leadership that can really make systematic change in your community for individuals needing behavioral health care. So oftentimes what we see is these organizations worked very much in silos historically, right? And so families, youth, adults would bounce from one to the next and, maybe continue to have law enforcement contact, maybe end up in a criminal justice or jail, juvenile home system, but really not, getting care and treatment like they so needed. And so CIT brings a 40-hour training to our first responders to respond most appropriately. And so to these sorts of situations. So they are trained into how to recognize signs and symptoms of mental illness. They're trained in verbal de-escalation skills. They're trained on certain populations such as intellectual and developmental disabilities, older adult populations, and really how to intervene or what to be aware of when they're on scenes with folks, youth as well. So we actually were the first program in the state of Michigan to train a whole 40 hours on youth CIT. So we targeted all of our school resource officers, and they were able to complete that. We work with we have 7 departments in Calhoun County, 7 police departments in Calhoun County. And so we were able to pull those SROs to be able to complete that 40 hours. So the program itself was originally a vision from Jeannie and Chief Blocker from BCPD at the time to pull this because, again, just an identified need to support our first responders. And since we started in 2017, we've trained about 140 first responders to be able to go out on scenes and have skills. And we've had about 1,600 CIT calls since we first started. Again, that's across all of our departments. We collect all of that data. Our use of force is about 6%, so quite low, and usually involving some sort of handcuffing. And then out of our 1,600 calls, only 21 people have been taken to jail, which means that they've been connected in some other way. So historically, it was usually our EDs, because that's our place for folks to go to get a mental health assessment. But now that we have First Step, we're seeing that as another resource to our partners. So all in all, a very proud program, and really seeing, we hear stories all the time about what it is like for families to interact with a CIT officer and how they're just surprised by what they know and the level of interaction and ultimately resource and connection they can provide to families.
Wow, so important. As I'm listening and I think about, the immediacy of people being able to access services at First Step, or the young person who then gets to get mental health supports right there during their school day, rather than that having to be something else that's, there's barriers in between. And then people who are really in crisis and law enforcement arrive and they're able to have a trained first responder who knows how to, it strikes me that, when you think about the statistics that we saw at the beginning of our session here, the amount of people who maybe would have hurt themselves or other people or gotten hurt in some way, who are getting the services right when they need it, where they need it. And that's, it's sobering to think about what would happen if we didn't have those kinds of supports, that continuum of care. Mm-hmm. So what's next? Where this is, for anybody, we've talked about all these services and this continuum that we've been able to craft here together with other community partners in Calhoun County, but, where else do we need to roll our sleeves up and get to work? What are the other opportunities that you all see where there's a gap or a need that as a community we need to be thinking about?
So I can't help but, I love the conversation we've had today about access of care and ease and really meeting folks where they're at, be it physically meeting them where they're at, right? But I can't help but continue to think that mental health and mental well-being is a shared responsibility, and the need for a community response in that shared responsibility. And so, at Summit Pointe, we work very hard to get folks trained in things like mental health first aid or QPR, question persuade response, because there are still folks who aren't being serviced, and there's just still a lot of misconceptions and stigma around behavioral health. And so I think there is room to continue to provide education. We know, it's a standard for folks to get trained in CPR, right? It is across the board. Most folks have received that sort of training. But what's the number of folks who have received something like mental health first aid? And you're right, we'll quote those statistics again, right? It's certainly not for a need to do it. The numbers are showing us people need an understanding and knowing how to intervene. And at this point, I don't think we're there yet. But it's something, we work very hard at really getting that availability and information out to folks so they are equipped to respond, because we know it affects, right, 1 in 4, 1 in 5, depending on what stat you may read, and it is likely you will, if you don't experience it yourself, you have someone in your close circle who does. And so I think we need to continue to look at this as a shared responsibility. It's not, you talked about it earlier, right? That the answer is not always to put a clinician in a spot. We don't have the resource to do it,
sure.
right? It just is not feasible. So what can we all do to create a community of well-being and understanding, I think.
So from my perspective, I became the CEO of Summit Pointe in 2015, and at that time, I really wanted to take, with purpose, so look at programming for I'm a systems person, so I really wanted to look at the systems that build a healthy community. So Summit Pointe is a community mental health. We have a hospital system. We have primary care systems. We have schools. We have law enforcement. We have the jail, the correction services, right? So the pieces that we're kind of moving into with Summit Pointe, as Megan said, we've worked with law enforcement. We've got First Step, right? We've got some of these pieces. The next pieces that we'll be moving into is a stronger relationship with our primary care offices, and how can we, from Summit Pointe, from First Step, start a medication, look at some kind of medication management, and not have to see them long term, right? We should be the specialty consultation and then getting them to a primary care office that can serve them. We know that the majority of mild to moderate or the low acute mental health can be served with medication. It doesn't have to reach therapy, doesn't have to reach our level of services as a community mental health provider. So really starting to gain a lot of traction and education and awareness within the primary care community. And the other piece I see that we'll kind of grow into more is with the corrections and jail services. So we've been fortunate to have some monies granted to us through ARPA, through the Calhoun County. We've been able to look at how to provide services differently within the jail, and then as people are being released from the jail. We know that in Calhoun County there's a high opioid epidemic, and so a lot of the people entering and being released from jail have substance use disorder. We're using First Step to be able to start people on medication-assisted treatment right away after release. But then it's the services that come after. So really trying to build that system within the context of our continuum of care that we are looking at. So those to me are a couple areas and gaps that will continue to grow in our community at Summit.
I was actually kind of thinking along the same lines too, GD. One of the relationships that we've developed over time is a relationship with Children's Hospital of Michigan in Detroit. And really what was behind that was trying to integrate behavioral health services into the primary care setting, because we know that oftentimes the first contact with any type of mental health conversation is in your primary care visit and your well visit. And so to me, continuing to look at how we can integrate into some of those systems where talking about access, how can we integrate and make sure that kids have services and families have services right away. With our relationship with Children's Hospital, we're able to co-locate services there. So if there's a need, the social workers and the physicians working with those families can refer right to us to provide services. And so we've heard a lot from feedback from those professionals about just how that creates just less issues with access, and we don't see those kids kind of fall off the radar, and rather than referring out to a behavioral health provider. So I was actually kind of thinking the same thing. But how can we integrate into more settings like that?
Sure. So we're nearing the end of our session, so we're going to switch to some Q&A from our live studio audience or from all of you who are tuning in virtually. So if anyone in our audience has questions, certainly raise your hand. So that's a great question for our live audience, our virtual audience. The question was, so thinking about, first step or the rec, or I guess we could probably add CIT to that. We have those programs now in our community, and we're proud of what those are doing. So how about other communities maybe who aren't there yet, where there's stepping stones along the way to getting there, or ways that you were able to meet some of those needs along the way in building those? I'll start for a second while my guests here think about it. So when I think about the rec program, so the rec program being that half-day immersive experience for middle school age students who need that extra level of support, it was really born out of, in many ways, Starr's work in some of our local schools. So we had resilience coaches, what we call kind of interventionists, who were in the schools training staff on those tier 1, understandings, and then out of that, then we were helping schools think about how to provide themselves some pull-out services in a more strength-based way. So a lot of schools have maybe things like an in-school suspension. They're usually called something nicer, like the Success Place or whatever, the Happy Kids Club, but it's really like an in-school suspension space that feels punitive, that is punitive. And so helping schools then rethink that and create reset spaces where kids are equipped with the skills. And maybe there wasn't a mental health clinician there all the time, but there was at least somebody who was trained to help that kid think through some things and build some new coping skills. So that was kind of a baby step in the direction of what became the rec, at least from Starr's perspective.
Before we had the urgent care center, Summit Pointe did offer 24-hour crisis services. It was just a phone contact, though, and it was hard to navigate, but you can navigate it, so it was possible. And you always have access to your local emergency department. And there you can be screened for suicidal and homicidal pieces, and then given a referral somewhere within the community. So, those are the systems that we used and we utilized for our community residents every day before we had the urgent care center. There, obviously, as we've talked, there is some stigma, there is navigation barriers, there are barriers, but it is possible to get help in that arena.
Sure.
Yeah, and I think from a CIT perspective, it's it's not feasible for every community to have necessarily a CIT program, or you're seeing more and more what they're calling co-response programs. Some of the resource-wise isn't anything. I think my advice or baby step is just having communities reflecting upon how are they working with local law enforcement, and that they're brought into the mix ultimately. I think they're when you think about behavioral health, they may not be a system that you think of, but again, all too often they are those first responders. And so partnering and really having solid relationships is really important.
My thoughts were related to partnerships and who you can identify as critical pieces to the puzzle when you're looking at community. So, identifying what the gaps are, and then who can we bring to the table to start having conversations on how we can meet those needs. I think that's the critical first step, is getting everybody that has a role to play at the table to problem solve.
Good question for our Summit Pointe guests, maybe Jeannie specifically. Jeannie mentioned earlier a community needs assessment. And so one of our live audience members, being a community member, is curious, what is a community needs assessment? How do you do that? And what are the needs that were represented in our community?
So previously, a couple of years ago, I think it was the ACA requirements require a hospital systems to do a community needs assessment. So they actually go out and find stakeholders within their community, and they ask them a series of questions about where their needs are, and they take that information and they quantify it up and put it in larger categories of need that a community may be seeking from the healthcare system. And so in Calhoun County, we have Bronson Healthcare, we have Oaklawn. We have also utilized the same process for our senior programming, and we compile those at the Coordinating Council, which is a subset or a program of Summit Pointe. The Coordinating Council takes all that information, coalesces all together. We then pull together a community stakeholders, much like a bunch of organizations. We bring together reps, and we listen to what the community says, and then we take and vote and prioritize on what we're hearing the needs are of the community. And then we move that work forward within the Coordinating Council. And so right now, the high needs that we're working on are behavioral health, including mental health and access to substance use disorder. We are looking at maternal infant health. We have the social determinants of health. All of those pieces are kind of rising to the top. And this year, in addition to the Coordinating Council, we also have the Public Health Department. They are going through a community health initiative program, improvement program, and so they've identified another couple areas that we are putting work groups around. And so through that community needs assessment, through those stakeholders' opinions and comments, and identifying those needs, we then coalesce around these areas with groups and have conversations and monitor the data. In Calhoun County, we utilize a website called mycalhoun.org, and we stack ourselves up against state indicators across the nation, and look to see how we're measuring up. And so that's what we do in Calhoun County, and it is every 3 years. And so we just went through one, and we'll be starting to gear up to go through that again.
Great.
It's a process. It's a huge.
That's
It's
quite a
huge.
process.
It is
Yeah.
a very large piece of work that we do.
But to your point earlier about what my answer could have been to that question that you answered so well, data is so important, right? And knowing, where the needs are at, and then whether or not the things that we're doing are actually moving the needle on those things, and then making those adjustments. It seems common sense, but there's a lot of folks who aren't doing that, or maybe they have the data, but they don't know how to interpret the data, and so that's so important. So we are coming to the end here. So I'm as I reflect on the conversation that we've had, the first thing that comes to mind that we've talked about, a lot is just removing barriers and creating greater access along a continuum of different services, meeting the needs of different, populations across our communities. But that makes sense. I think everybody gets that piece. The piece though that really stands out to me that I think, I hope people are taking note of, in our audience here and tuning in virtually, is the importance of partnership. And that, too often, I'm a educator by trade. So I come out of the education system, now in nonprofit. And we've talked about law enforcement, we've talked about healthcare. Too often, those entities are so siloed for I don't know what reason. Maybe just so focused on their piece of the puzzle, their work, that they're not really thinking about what's going on elsewhere. Maybe there's times when there's some weird competition, right? Competitiveness that occurs between different providers and organizations. But when we think about, this emergency around mental health, for children, adolescents, families, the need has maybe never been greater, and there has been some alignment around awareness and people getting it that this is a big problem that we need to address. There's been some funding that's been allocated that maybe hasn't been in the past. There's so much work to do that there's no reason, number one, to be competitive. There's enough work to go around. But number two, there's no way that I think as a community we can meet these huge needs if we're not working together and if we're not bringing all of these different pieces together, because we all have a piece of the puzzle. And so we're not going to be able to accomplish the lofty goals of creating, I think it was you, Megan, that said like a culture of well-being, right, for everybody, unless we're partnering together.
But that's where the data matters.
That's where the data matters.
Because you can't move the needle on any of your health indicators alone.
That's right.
You have to have partnerships. And so if you're not looking at the data, you're not paying attention to the partnerships,
Yeah.
it just all works together.
And when you form partnerships, you get new besties. You get new friends. So I want to thank our panelists again, Jeannie, Megan, Sarah. Thank you for joining me for this chat. I want to thank our sponsor, ITC, and Summit Pointe, Greater, for that. And I want to thank our studio audience and our virtual audience. I really appreciate all of you taking the time to listen to this conversation and all of our others. You can watch our previous Mental Health Matters sessions online. You can watch we'll be putting one out every month this year, and so you'll be able to see those as well. So thank you for being part of the discussion. Thank you so much.